Hello, my name is Barbara Weber. I'm a registered dietitian at Joseph Brand Hospital. Today's topic is on diet and nutrition for COPD. Proper diet and nutrition is very important. It strengthens the respiratory system, it heals and repairs body tissue, it prevents infection, it reduces the side effects of some medication, it improves your ability to exercise, prevents or reverses malnutrition, and it improves and maintains respiratory function. Now, what happens when you're overweight? Your heart and lungs work harder when you're overweight. Losing weight helps you breathe more easily and increase your energy levels. Tips to help you lose weight are: watch your portion sizes, make your plate before you sit down, use the plate method as recommended by the Canada's Food Guide to follow the types and amounts of food that are healthy. Limit high-calorie beverages such as juices, soft drinks, and any other sugary beverage. Now, what about carbohydrates? Carbohydrates create more carbon dioxide in your bloodstream. Patients with COPD find it difficult to expel carbon dioxide and take in more amounts of oxygen. Your body does need some carbohydrates for energy, but complex carbohydrates like whole grain breads and cereals, fruits and vegetables are the healthier choices. Try to limit snack foods that contain carbohydrates, such as cookies, chips, and candy. Snack on proteins and healthy fats instead. How does COPD have an effect on our appetite? It increases fatigue while eating, causes shortness of breath or swallowing air. The result is gastric bloating, discomfort, decreased food intake. The solution is to have smaller, more frequent meals, choose foods that are easy to chew, eat slowly, taking smaller bites, use deep breathing while chewing, and try to clear airways of mucus at least 1 hour before a meal. Rest and use your bronchodilators, such as Ventolin, before a meal. Save your liquids until the end of the meal. Sit up while eating. Use pursed lip breathing before and after a meal. Defer conversations until after your meal, thus saving your energy. And if you have oxygen at home and use it during a meal, it may lessen the feeling of shortness of breath. Now here's an example of Canada's Food Guide, the plate model. The plate model, which replaced the portion sizes, shows the amount of protein, whole grains, fruits, and vegetables. The plate model helps you choose foods that improve health, meet nutrient needs, reduce the risk of nutrition-related and long-term diseases and conditions. The Canada's Food Guide is designed to be flexible, includes healthy eating tips, and recommends a variety of healthy food choices. Canada's Food Guide recommends serving sizes such as the previous slide, which demonstrates fruits and vegetables should occupy at least half of your plate. It could have leaf lettuce, tomatoes, strawberries, blueberries, just to name a few examples. Protein should consist of a quarter of your plate, such as chicken, fish, beans, and lentils. Whole grains should be a quarter of your plate, such as cooked rice, whole wheat breads, and bagels. What are some of the healthy choices? Plant-based proteins such as beans, lentils, legumes, and nuts are recommended rather than animal-based proteins such as meat, milk, and poultry. But it was never intended that the animal proteins be eliminated from the diet except to have it in reduced capacity. Cut back on sugars such as juices and pop. Water, coffee, tea, and plant-based beverages such as smoothies are encouraged. Cut back on alcohol because of its association to liver disease and some types of cancer. Processed and prepared foods such as microwave meals and takeout foods are higher in sugar and should not be eaten regularly. Now, dairy products, low fat and unsweetened dairy products are healthy alternatives to high fat and sugary content products. Eating red meat is acceptable with preference given to plant-based proteins versus processed foods such as lunch meats. Healthy eating is awareness of your eating habits, taking time to eat and notice when you are hungry or full. Awareness of your eating habits will help you make healthier choices which lead to positive changes. Try new foods. Enjoy the food you eat. Prepare and cook your own food. Try planting a vegetable garden and using those vegetables in your daily habits. Try to eat with family and friends to increase social interaction. Cook enough to have leftovers that you can freeze. Healthy eating methods such as baking, grilling, broiling, roasting, steaming, and stir frying are recommended. Choose foods with labels that indicate the salt, sugar, fat content, and of course, food allergies. Prepared foods can contain higher levels of sodium, sugar, and saturated fats. Now, just to review again, eat healthy diet when you have COPD, as it strengthens the respiratory system, it heals and repairs body tissue, it prevents infection, it reduces the side effects of certain medication, it improves your exercise tolerance, it prevents and reverses malnutrition, and it improves and maintains your respiratory function. Now, what about COPD and malnutrition? People with COPD can expend up to 50% more energy to breathe when compared to healthy individuals. Progression of symptoms such as shortness of breath, dry mouth, fatigue, and early feelings of fullness can lead to decreased intake, and when prolonged, significant weight loss and malnutrition. So, what to do? Eat smaller meals, 5 to 6 per day, which prevents the stomach from feeling full and allows the lungs to expand. Being malnourished and underweight can increase your risk of getting a lung infection. If you need to gain weight and improve nutrition, try a high calorie, high protein diet, which helps the body heal, rebuild muscle, and increase weight gain. Adding 1 to 2 tablespoons of skim milk powder to each half to 1 cup of cream soup, pudding, and mashed potatoes. Eat more when your appetite is good, and eat cheese or add cheese to pastas, vegetables, and salads. Yogurt is a good source of protein, especially Greek yogurt, as it has double the protein of regular yogurt. Add eggs to your salad, to pasta, eat more omelets to increase your source of protein. Increase healthy snacks such as fruits, vegetables, and healthy proteins. And if increasing your daily diet is a challenge, try adding a nutritional supplement such as Ensure, Boost, and Resource, just to name a few. Now, what about constipation? What can you do to avoid constipation? Well, you need to have adequate fluid intake, 6 to 8 cups a day. Increase your dietary fiber, 25 to 35 grams per day is recommended. And examples are whole grain breads and cereals, fresh fruits and vegetables, whole grain pastas and rice, and nuts and seeds. Exercise is tolerated. If you have dental issues such as mouth pain, ill-fitting dentures, or lack teeth, it makes it more difficult to chew properly. Change the texture to a more softer food choices such as soups, puddings, bananas, mashed potatoes, fish, meatloaf, and casseroles. What about COPD and fatigue? Because eating and digesting take up a lot of energy, allow some rest time after each meal. 15 to 20 minutes is recommended. Try to stay sitting up after a meal. This will aid in digestion and decrease pressure on your lungs. Use Meals on Wheels if available. Ask your family to help in meal preparation. Eat smaller, more frequent meals. Eat the largest meals when you have the most energy. What about nutrition and mucus? Try to have 100% orange juice. This can aid in thinning out the mucus after a meal. Milk and dairy products do not produce more mucus, but it can coat the mucus you already have present and make sure you have more water. What if you have a dry mouth or throat? Dry mouth and throat can make food unappetizing and cause decreased intake. Causes of dry mouth and throat can occur when certain medications are given, such as a decongestant, antihistamine, and a diuretic. Try good mouth care after meals and inhaler use, and have more moist foods. What about salt intake and COPD? Reduce salt intake if high blood pressure or water retention is an issue. Water retention makes it more difficult to breathe. Salt intake should be limited to 1,500 to 2,300 milligrams of salt per day, which works out to 1 teaspoon of salt. Processed foods such as bacon, ham, sausages, and luncheon meat, potato chips, and other fast foods contain high amounts of salt. Foods can be flavored with pepper, onion and garlic powder, oregano, basil, or any fresh herbs. Avoid foods with more than 300 milligrams of salt per serving. In summary now, eat foods that are easy to chew. Eat slowly, take smaller bites, and try to breathe deeply while chewing, while avoiding too much talking. Clear airways of mucus at least 1 hour before a meal. Use your bronchodilators, such as Ventolin, before meals. Save your fluids until the end of the meal to avoid early feeling of fullness. Try to sit up during meals. Utilize pursed lip breathing. And for Canada's Food Guide, use the plate methods, ensuring that half of your plate is fruits and vegetables, a quarter of your plate is protein, and a quarter of your plate is grains. Try to drink 6 to 8 glasses of fluid a day, unless you're on a fluid-restricted diet. And then you should have fluids such as water, 100% juice, milk, tea, or coffee. Rest if you become tired. Think and plan ahead. Avoid processed foods instead of choosing foods that needs to be prepared. Pace yourself to maximize energy. Read food labels to be aware of salt, sugar, and carbohydrate amounts. Use breathing techniques to decrease shortness of breath while eating. If possible, cook and eat with family and friends. Use supplements such as Boost and Ensure if you are underweight. Eat smaller, more frequent meals. And there are resources to help you learn more about nutrition and COPD. Thank you and have a nice day.